A free healthcare clinic in Normal, largely dedicated to serving the uninsured, is looking for a new leader. Its executive director for the past 5 years has resigned, as WGLT's Melissa Ellen reports.
For 30 years and through months of uncertainty following a loss of nonprofit status, the community healthcare clinic in Normal has persisted. It's continuing to provide free healthcare services to a largely uninsured population and plans to keep doing so. For the last 20 years, Mike Romagnoli is now gone. He resigned Friday to pursue a new opportunity. This, according to a news release from the clinic. Board President Jamie Matthew says the departure wasn't a shock, and an interim is already in place.
It was something that we had been setting things up for a little while on, and Mike did a bunch of amazing things for the clinic, and we're absolutely overjoyed for his prospects for the future.
Last year, the clinic lost its nonprofit status with the IRS after failing to file the proper tax forms for 3 consecutive years. Losing tax-exempt status can put a nonprofit's funding in jeopardy. Before he left, Matthew says Romagnoli was able to find and file paperwork to the IRS that would get the clinic reinstated as a nonprofit.
We're happy that part got done, and now we're just waiting. The IRS is not a fast-moving entity.
Matthew says the clinic has continued providing all of its usual services since Romagnoli departed. This includes programs like the dental clinic and mental health counseling that the former executive director pioneered. Sonia Reese, who serves on the McLean County Board of Health, has temporarily taken over to keep things moving. Reese also served as an interim executive director for a stint in 2002, when the organization was in a similar situation. She says it's been an adjustment. In the past 2 decades, everything has been transitioned to a digital platform, but she's been adapting. She's already got a priority list going. Reese says filling open positions ranks high. The clinic is currently short a nurse and will require part-time pharmacists from March when the full-time pharmacist is away. As for who will take over as permanent executive director of the clinic, board president Jamie Matthew says the search is in progress. Applications haven't launched yet, but he'd love to fill the role soon. Better yet, in the next 90 days.
There's a lot of competition for good candidates for every profession, every job role in the medical field right now. And, I don't know if that's realistic, but that's my perfect world, right?
Interim executive director Sonia Reese says she won't be applying.
There's lots of good people in this community that can do this.
In the meantime, a language services void has opened at the clinic. Romagnoli and the nurse who left in December were 2 of 5 total clinic staff who speak Spanish. Most of the clinic clientele are Spanish-speaking. Matthew says the clinic is interested in having English and Spanish speakers assume the open roles, but it won't be a requirement. Matthew says there are other tools the clinic can use to bridge the language barrier gap as well, including translation services and the pursuit of volunteers with secondary language knowledge. I'm Melissa Ellen.
Melissa Ellen covers mental health as a Report for America Corps member. Report for America places journalists in local newsrooms across the nation to cover underreported topics.
Support for WGLT mental health coverage comes from Report for America and Chestnut Health Systems, caring for the community's physical and mental health and celebrating 50 years of service.